Status of the administration of the COVID-19 vaccine, especially the halting of the Pfizer vaccines, and then Sri Lanka waiting till the AstraZeneca vaccine doses coming, and then okay, there are comments that this particular Pfizer remaining doses are they are to be given to the elite Colombo or very rich people. Well, based on these arguments and disagreements, I think our health sector is a total failure. So before long, we are get affected, all of us. I think Sri Lanka must first look into this nursing staff, and especially the male and female nursing staff, and giving them appropriate education. And not only that, selection of this nursing staff recruits must be done on properly, after GCA level, based on the EZ score, and then they have to be interviewed and see their suitability to join the nursing staff. So thereafter only, I think the existing nursing staff also must be told to, they are being interviewed and to follow a degree course in nursing science, especially currently the Bachelor of Science nursing degrees offered by the Faculty of Nursing of the University of Sri Jayawardhanapura and the University of Colombo. But rather than doing like this, I think it's better to create a University of Nursing of Sri Lanka dedicated to the nursing profession, and then have different faculty of nursing for faculty of pediatric nursing, faculty of different fields of medicine. There has to be, I think, there have to be different nursing staff. Say for children care, there has to be pediatric nursing, and also for oncologist patients, oncologist related nursing staff. So such a university dedicated to the nursing education, University of Nursing of Sri Lanka, could have different faculties to support the education of nursing staff in different fields, at least according to the the hospital specialization system in Sri Lanka. For example, there are women's hospitals, there are cancer hospitals, there are children's hospitals, etc. So accordingly, the nursing staff must be given a suitable training related to the hospitals that are there in Sri Lanka according to the hospital structure. Because a general education in nursing, such a nurses services could be restricted practically when working in different types of hospitals. For example, a children's hospital nursing staff shifting into a women's hospital nursing staff, and then shifting into a cancer hospitals nursing staff. Then there could be a different same general nursing education. More than that, I think there has to be like specialized nursing degrees according to the hospital structure that is based on the different categories of patients in Sri Lanka, such as women's hospitals, children's hospitals, and cancer hospitals, etc. I think this way, then once nursing education is centralized into one University of Nursing of Sri Lanka, such a university could handle this, rather than the current system of having faculties of nursing under University of Colombo and University of Sri Jayawardhanapura, where a general education is nursing provided. So I think the government must look into this, and also, as currently done, after such nursing graduation through the University of Nursing of Sri Lanka, they must be given registration as presently done by the Sri Lanka Nursing Council, which is already there. So similar, I think when it comes to pharmacists, currently the University of Colombo offers pharmacology courses, and also there are private institutions that offer pharmacology courses. So, and the Sri Lanka Pharmaceutical Association, they give the Pharmacists Association rather give the registration for them, and thereafter they authorize them, and the Sri Lanka Medical Council only give the final registration to be qualified as a pharmacist. So So I think similar to the Sri Lanka Medical College being dedicated to the doctors registration, and Sri Lanka Nursing Council dedicated to the registration of the nursing staff, Sri Lanka, there has to be like a Sri Lanka pharmacist council, and taking away the current method of registering the pharmacists with the Sri Lanka Medical Council, because when it comes to pharmacist job and the doctor's job, there is a conflict, because we know that the doctors depends on the supplies from the private companies that import drugs, medicine, various brands of medicines which are branded. The generic medicine is branded by different companies in different names. So on the other hand, we can also see the government state pharmaceutical corporation manufacturing its own drugs, medicines. So when it comes to private suppliers, they promote their branded medicine in an unethical way by offering certain doctors, after say about lapse of 1 year, if they find according in their computer databases the private importers of these medicines to Sri Lanka, that the doctors have recommended their medicine much more, then they are being offered foreign tours, or various offers are there for the doctors to choose. So accordingly, the doctor's family is sometimes given a foreign trip just because they have loyally dedicatedly prescribe a certain company's branded medicine. So this is not really going to work. I think this is not going to be good, because then the focus on the welfare or the well-being of the health of the the patient, the doctor cannot really focus on that. If we think about these such benefits coming towards him, how much the intellect the doctor has, doctors also are humans. So because of this way of incentives, doctors can be sometimes indirectly or directly they prescribe certain branded medicines, which can be sometimes very expensive for the patient also, rather than recommending some drugs which are available at a low cost from companies from India. Sometimes if high cost branded drugs of the same generic drugs, medicine are recommended, it's unfair for the patient also. So from this point of view, I think that there is a conflict when it comes to the pharmacist job and also the doctor's job, because pharmacists, they sometimes the doctors issue the certain prescription under branded names, and the pharmacist issue such medicines to the patients. So then obviously the pharmacists sometimes say the certain branded instead of this, sometimes if the doctors issue the the prescription in the generic name of the medicine, say paracetamol for example, of course there's no prescription needed for that, but if it is on the generic name, the pharmacist decide the brand. Then sometimes the doctors say don't issue any other brand, only this brand issue in the prescription to the pharmacist. But the pharmacist sometimes say to the patient this brand is not available, and he or she decides the brand. So there is a indirect, very subtle conflict of interest between the pharmacist job and the doctor's job, as far as the doctor's role in issuing the these prescriptions to the patient, and the pharmacist's role in selling the prescribed doctor's prescription medicines to the patient. So because they can work together, because they have this, if they are registered in the same Sri Lanka Medical Council, the doctors get registration at the Sri Lanka Medical Council, and in Sri Lanka the pharmacists also get the registration at the same Sri Lanka Medical Council. That is why there has to be a different Sri Lanka Pharmacist Council, and also like a different University of Pharmacology of Sri Lanka, right? So then accordingly, such a university must give a Bachelor of Science degree in pharmacology under government of Sri Lanka, the University of Pharmacology of Sri Lanka, and then accordingly based on that degree and also appropriate internships with a pharmaceutical pharmacy, then Sri Lanka Pharmacist Council, similar to Sri Lanka Medical Council, Sri Lanka Nursing Council, Sri Lanka Pharmaceutical Council must give the registration. This helps them to specialize in their field, and also the interference through the import companies of the medicine and drugs they have some indirect influences on the pharmacist and sometimes the doctors. So because when the particular pharmacists look at the prescription, they know the doctor's name seal appearing on the prescription. They know that this particular doctor issues this type of branded medicine only. So because they rely on the Sri Lanka Medical Council registration, the pharmacists, then of course there's a conflict together. It can result in a like a very unacceptable standard when it comes to issuing medicine to the finally to the patient who come to take the medicine for some illness. So because of this situation, these two professions must be separated, similar to the University of Nursing of Sri Lanka, University of Pharmacology of Sri Lanka, and similar to the Sri Lanka Nursing Council, Sri Lanka Pharmacist Council must be established for this purpose. And also the present way of issuing the doctor's prescription physically, or by hand, which results in various issues, because once these prescriptions are issued, there are no carbon copies. Sometimes with the doctors don't have a carbon copy because they are written by hand, and neither the pharmacists keep a record of this. What they do is the pharmacy staff put a seal on the prescription and say medicine issued. But then this is not the best way, because there is no register at the pharmacy, neither there is a register with the doctor about the prescribed medicines he or she issued. So there has to be a computerized system through apps where the doctors can download that apps on Android or iPhone phones as prominently available in Sri Lanka, and then put the name of the patient, and then get the details of the online whether this particular drug, whether it's a generic drug or a branded drug, when according to the choice of the patient, the closest pharmacy, the doctor could be through the apps see the availability of this particular drug. There can be different drugs at the closest pharmacy to the patient when the patient visits the doctor. Say doctor is in somewhere in Colombo and the patient lives in Kohuala, then accordingly in the Kohuala area, the closest area, the doctor can search based on the online app, and then issue the prescription directly copy to the pharmacy where there is a stock, so it can be reserved till the patient comes there, and a copy goes to the smartphone of the patient. If the patient doesn't have a smartphone, it can be diverted as a SMS message to the patient, or a copy can be directly sent to the pharmacist, so who can then have the details of the the NIC number, the name of the patient, etc. Accordingly they verify it and set it. Then these records of this selling of these drugs or vaccination programs or injections or capsules or syrups or all sort of medicine recorded in a certain database which offers this service through the apps. So this way there is some accountability, because the doctors have to put some effort, get the details of the name of the patient using his or her smartphone. The doctor has to get the NIC, address, type it and put the details, and then issue the search for the closest pharmacy. Then doctor becomes more concerned about the patient. That way the doctors can develop their professional concern for the patient more, rather than being like today, where the consultancy fees and the doctor's fees are very high, and just certain prescriptions are issued and doctor just write the name even and the age only, no address, no NIC numbers are put on the prescription, and that way of accountability is missing there. So more concern comes from the doctor's side if this new system is offered. So I think it has to be considered, and also the stocks of medicine that are being produced locally and imported to the country must be recorded in a particular database of the health ministry, which can be linked to the private companies' databases once they arrive from the customs department of the government of Sri Lanka through the different ports and the airports. Now we know the COVID-19 vaccines come mainly through the airport in Colombo, Bandaranaike airport. So wherever it enters the country, immediately it must be entered into a national medicine database relating to the capsules, tablets, syrups, all sort of things, vaccines, injections, etc., as long as it's given to a human or an animal. So these records must be there in a computerized database. So accordingly, when they are being promoted by the sales representatives of the government pharmaceutical corporation or the private importing companies, accordingly the pharmacy databases are upgraded. The amount of particular type of medicine, whether branded or different brands or generic, transferred to the pharmacy computer databases are recorded online, not in the pharmacy physical computer premises. So then it can be based on apps for this matter. So same app. So then based on this Android or iPhone app, then when the doctors issue the pharmacy from the their clinic or hospital, they can immediately know whether this particular drug is available, or whether injection or vaccination or capsule or syrup or whatever the medicine, for a human or animal, which is available at the particular pharmacy. Because sometimes patients go searching for the particular prescribed things by the doctor in different pharmacies. Still is not available. So doctors end up issuing a prescription for a certain branded medicine, and when you go to the pharmacy say, no, it's not there, we can only give this. Then the patient who is having a sickness is having more problems then, and his or her sickness can aggravate as a result also sometimes, and hopelessly they end of the day return home after paying exorbitant fees to the doctors. So doctors have to take more responsibility here, since they charge more fees from the patients. That is the situation. Doctors can charge high fees since they got educated on their own. But then using the free education systems, the taxpayers' money, they get their education, and they have some accountability when it comes to the patient's welfare. So this type of method, I think, would ensure a proper service from the doctors to the through the pharmacists to the patients. So I think as far as the administration of the vaccines and the injections, it's actually done by the nursing staff. So at that point also, the hospitals must have certain type of app for the nursing staff who administer the particular vaccine. Must under the apps, each nursing staff must be ready, who's with the registration details with the Sri Lanka Nursing Council, must record the type of injection or the vaccine that he or she administered based on the recommended prescription from the doctor issued through a pharmacy. So this way it results in more accountability and responsibility from the doctors, the nursing staff and the pharmacists towards the patient's well-being, and finally it results in a good health for the person who come to take medicine in case of some sickness. So this is why even the Gautama Buddha has said, in teachings, has taught that there was a monk who had, certain wounds on his body, and no other no other disciples of the Gautama Buddha volunteered to, even wash this particular monk, a normal monk who was sick. But Gautama Buddha then volunteered and, personally wiped the, all the wounds, and accordingly the treatments was given later. So here what the Gautama Buddha said was, anyone who with lot of care, according to the Gautama Buddha's teachings, any person, whether it's a doctor or a nursing staff or a pharmacist or a paramedical staff or whether it's a attendants in the hospitals or minor staff in a hospital, these categories, or a specialized doctor in that case, or a general doctor, whoever look after the patient with more care, more concern, is serving the or treating the Buddha, Gautama Buddha himself. Such a effect is there for one's brain mind development, and subsequently the brain cell control and the mind perfection and the cognition perfection. So that is why this system has to be corrected. And also when it comes to hospital attendance, a similar method must be there. Once they take a patient, because sometimes we have seen in Sri Lanka the hospital attendants, they recruit from normal low income groups who are educated through the free education system, but still it's a job restricted to the low income groups. So in Sri Lanka, so what happens is ultimately they are treated as inferior this became issue in Sri Lanka a few years back when the hospital attendants were given a similar female attendants were given a similar uniform to the nursing staff. Then nursing staff strike based on this, that the patients can't, that they didn't like to have same to have identical, like almost like different, but sometimes it's similar, but so they protested. So this inferiority of the hospital attendants job in Sri Lanka, hospital attendants are treated like sometimes people who are working as jailers. They are treated as very inferior job. This must be stopped because they are much educated in Sri Lanka today. The younger generation who are working as hospital attendants, they are much more better sometimes than the nursing staff, or sometimes than the paramedical staff, or even the doctors. It is the attendants who are much more closer human side to the patient. So they must be accordingly given a proper education, maybe through a university dedicated to that profession, or I think probably, and a proper once they join after initial training orientation program in the hospital, and training and initial orientation, they must be, while pursuing their careers as an attendant, must be told to follow the particular dedicated university for this hospital attendance education and pursue bachelor's degree. That is the best way to help them, because they are more qualified, they are more educated, they are more human after all than the nursing staff and than the doctors and the specialized doctors. Because of them only most of the government hospital, private hospitals run, because of their kind service. This has to be recognized. So accordingly, there has to be a specialized Sri Lanka hospital attendants council to register them, and also which attendants is responsible for a certain task, because when it comes to attendance on a ward or a particular matter, it's not possible for them to record each and every patient. They will be responsible for a group, so their time and the the time and the day and their duty must be recorded in a particular apps to keep a record of and more accountability, responsibility for the hospital attendants jobs. I think this way they can be also make more professional, because they deserve it, because it's because of the government hospitals attendants only the most of the patients get a better service from them than the nursing staff or the doctors or the specialized doctors in Sri Lanka. And also when it comes to paramedical staff who visit the location in ambulatory services, similarly in order to streamline, because currently the suicide ambulatory staff they are being trained in Hyderabad in India. So there has to be a Sri Lanka University of Paramedical Services of Sri Lanka, and accordingly same way Sri Lanka paramedical staff council to register them, and and they must be also given normally, like when you compare with the doctors and nursing staff, of course they have to get qualified and join the service. But then when it comes to these hospital attendants and paramedical staff, well, after initial about 3 weeks training, and thereafter both hospital attendants and paramedical staff could be given an orientation program for a practical work site, and then they can absorb into the service. But once they start, they must be asked to register, compulsory for them to register with their particular university of dedicated to the hospital attendants, and the university dedicated to the paramedical staff, and then pursue their degree, and while working they can complete their degree. Not like where the doctors and the nursing staff must get the degree and join the service. But when it comes to these services, I think while they work they can do their degree programs, and this is the best way to improve the Sri Lanka service. And as I said earlier, the janitorial services which are outsourced to private companies are finally ending up in the the bank janitorial staff transferred overnight to the hospitals, and they don't know the hygienic differences between the bank and the hospital. So they have to be janitorial staff who are coming, since it's outsourced now, not by offered by the government employees. Those institutions must be given some certification as to people absorbed into the hospitals to provide janitorial staff in order to overcome the current unhygienic conditions, especially in the government hospitals, as we can see more prominently. I think this way, all these Sri Lanka government hospitals and the private sector hospitals related, most of the problems can be solved. And not only that, from Sri Lanka, even in Sri Lanka Navy, we know that Sri Lanka's some the Navy, the Vice Admiral Daya Sandagiri is a person who became the Chief of Defence Staff, and he joined as a sailor, someone who was on the road, even as a soldier in the army. Sailor, he became a he was not an officer, and then he became the commander in the Sri Lanka Navy, and I think he was the Chief of Defence Staff. So such a system must be there for Sri Lanka hospital attendants who have the degree education, Sri Lanka paramedical staff who have a degree education, Sri Lanka nursing staff who have a degree education, to go into the next level. So for example, Sri Lanka hospital attendants staff could be promoted as paramedical staff, and the paramedical staff can be promoted to do the I think the doctors MBBS programs, and the nursing staff must also be given an opportunity to follow the MBBS programs in the government faculty after allocating a percentage to them. And even the hospital attendants who come up through the ladder with hard work, right, must be, if after a certain extended period of training, from hospital attendants to paramedical to nursing, they can also be accommodated finally, if they, based on their hard work, commitment and intelligence and creativity, and allocation in the medical faculties, to join the medical staff, provided they put a lot of effort in this particular profession. So similar to that is how the Sri Lanka's Navy commanders like Dayak Sambagiri, who is actually a normal Navy soldier, who normally we can see on near the Colombo port. There are Navy soldiers like wearing blue color uniform. He was someone like that who became the commander in the Navy, which is very, it shows that all the way the path is there for self-fulfillment needs to be fulfilled, and it's up to the person to go to the top. This way, I think the whole medical system, education system, the whole system, private sector can be, government sector can be corrected. And also the indigenous medical system, which is available, different forms of indigenous medicine, Chinese medicine, homeopathic, Ayurveda, Siddhartha, and in USA there are different methods. So these USA has their own like special, the whole body based medical approach. I don't remember that name in the US indigenous medical system. So those must be checked, and those must be accommodated into Sri Lanka, into a not only the Ayurveda or Siddha Veda present system, as in we can see there has to be a particular university for indigenous medicine, University of Indigenous Medicine of Sri Lanka, that accommodates Sri Lankan indigenous medical professions, as well as Indian, Chinese and African and American, European, all indigenous medicine, and the students must be given the opportunity to select and pursue, and accordingly their their courses and their training and their councils for their registration must be specifically registered in Sri Lanka.